and the Indian variant. The Prime Minister said that he's anxious about it, but is still pushing ahead with relaxing restrictions. Is that wise?
Well, we are clearly moving at speed and scale with the vaccination programme, and that is one of the, it's the number one test, in fact, in the 4 tests that we apply. We are vaccinating at scale. We're about to reach about 56 million doses delivered, almost 36 million people with the protection of first dose. But there are concerns in areas like Bolton and Formby and, of course, parts of London that the B1617.2 variant, which was initially identified in India, could be more infectious. We've seen infection rates rise by, from 520 last week to 1,313 this week. Hence why the surge testing and enhanced tracing is taking place. 800,000 PCR tests have gone out, 15 areas in England. But we think that the roadmap for Monday remains in place because the vaccines are delivering, and vaccines are keeping people out of hospital and, of course, away from severe infection. So we're confident of that. And then, of course, we'll continue to monitor, because the reason for the 4 weeks plus 1, the 5-week interval between each step is important to be able to look at this data. And we will continue to be guided by the clinicians, by the data, as we have done with this announcement last night of the additional surge testing. 100 nurses, directors of public health, environmental health practitioners going into Bolton to make sure that we test at scale, genome sequence and isolate. And what people can really do for us to break this cycle of transmission with this new variant is, if you are found to have the virus, whether symptomatic or asymptomatic, to isolate as quickly as possible. And of course, to make sure you get tested and come forward for your jab when you're eligible.
Professor Christina Pagel from Independent Sage says that Monday should be delayed as the 4th test for relaxing restrictions hasn't been met. Are you taking that advice on board? You're saying that it's going ahead with the restrictions being relaxed on Monday?
Well, I just outlined the first of those 4 tests, which is that vaccine deployment remains at scale, and that is continuing. Of course, vaccine effectiveness remains in place. That is also a big tick. This new variant doesn't seem to, at the moment, we have no evidence that it escapes the vaccines or is more severe in its impact on people.
So
and then
you're disregarding, sorry to interrupt, you're disregarding the advice to delay opening up on Monday?
Well, as I said, the 4 tests for Monday have been met. We continuously monitor the situation. The clinicians meet regularly. The Prime Minister's briefed on this daily to monitor and look at the data. The reason that the Prime Minister announced the 4 weeks plus 1, so 4 weeks of data collection, and then that final week to make sure everything is in place and all the tests are being met before we open up, was met for the Monday opening. Now we've got another period of 4 weeks plus 1 before we get to 21st of June, and we'll continue to monitor that. Part of our getting back our lives is scale vaccination and the ability to surge test by postcode to then genome sequence those positive tests and isolate. And as I say, we need to do both things at the same time to be able to meet our roadmap to reopening the whole of the economy and getting our lives back. But we take those tests very seriously. And of course, one of them is the test on variants, which you've just asked me about. And that is why today we are having this surge in our ability to test people door to door, make sure we give them both the PCR test, but also they can take advantage of the lateral flow tests. These lateral flow tests are amazing. You do them twice a week, and as long as you're negative, that's great. Once you're positive, you do your PCR test, and that's how we overcome this virus. We keep it under control and then get our lives back.
Are we likely to see local lockdowns? Do you still see that as an effective means of containing the virus?
Well, as the Prime Minister set out in the roadmap, the 4 tests are the important measure. So vaccine deployment, vaccine effectiveness, the keeping infections under control today is very much part of that, actually bearing down on infections, because the virus will attempt to mutate and survive and by infecting more people. And then, of course, keeping an eye on variants. We rule nothing out in terms of whatever action we need to take regionally or nationally, we will take, whether it's flexing the vaccine program, as you were describing in your introduction to this piece. We will rule nothing out to make sure that we bear down on this virus and get our lives back according to the roadmap.
And how is bringing forward the jabs of 10 million people, so decreasing that 12-week gap between vaccinations, how is that going to help? Would it not be more useful to look at vaccinating younger people who might be transmitting the disease more?
So, again, really important question. The clinicians will look at all of this to see how we can flex the vaccination program to make it as effective as possible to deal with this surge in this variant, the B.1.617.2. They will make those decisions, and we will be ready to then implement, whether it's vaccinating younger cohorts. We've been doing some work on multi-generational households where we vaccinate the whole household over 18s, and of course the older groups who are already eligible, or bringing forward the second dose. We'll look at all of that and be guided by the clinicians as to what we do on that. The important thing to remember is, we've been vaccinating at scale. And when you get the call, when you get the text message, we've just opened to the 38 and the 39-year-olds, then please come forward. And we've also made those vaccine doses available to, of course, Bolton, where they're seeing that spike in infections at the moment.
And those that are vaccinated sooner than the 12-week recommended period of time, which we're now told is most effective for Pfizer, will they have less protection?
So again, in terms of what the clinicians think we should do, if you go back to when we started vaccinating on the 8th of December, the most vulnerable, so residents of care homes, the elderly residents of care homes, the over 80s, over 75s, over 70s, and those clinically extremely vulnerable, that 15 million that we did by mid-February have already clearly got their second dose as well, because we're touching almost 19 million second doses. It's whether the clinicians think we need to protect more people, groups 5, 6, 7, 8, and 9 in that first phase more rapidly, or we should flex the vaccine program in a different way. But we're ready to look at all those options. But we'll be guided by the science. The clinicians will make those decisions. The important thing is actually the way you deal with this, and we've seen it happen. We've done it in parts of London in the past few weeks, where you surge test by postcode, you genome sequence, so you know what the numbers are per variant, and then of course you self-isolate. So the thing that people can help us with is get your twice a week lateral flow test. If it's positive, get your PCR test for free, and then isolate. Really important.
Okay.
This is the second day of Eid today, and I know many families clearly want to celebrate, rightly so, after the month of Ramadan, but just be careful, follow the rules, do it outdoors in 2 family settings. Rule of 6 next Monday. Be careful when you also socially interact.
Just very quickly, I want to ask you about the Greensill inquiry and David Cameron being accused not so much of lobbying as stalking ministers. You were one of the ministers that he lobbied. Do you think that his reputation is now in tatters, as it's been described? Has he brought the office of Prime Minister into disrepute?
Well, I think David Cameron did the right thing to come before 2 select committees yesterday and to be open and transparent about his dealings with government, with ministers. He himself has already reflected on this and thought, actually, yes, it was in the eye of the storm, if I can describe it as that, during the COVID pandemic last year. that he engaged with ministers, and maybe, as he quite rightly reflected, he should have just done it in the as you know.
He still hasn't been completely open. Didn't want to disclose how much he earned.
Sorry, Gillian, I didn't catch your question.
He still hasn't been completely open. He didn't want to disclose how much he earned.
Well, he did say that he earned a substantial amount of money, much greater than he would have been paid as prime minister. He also, made all his communications public, and he, subjected himself to the scrutiny of the select committees and promised to come back as well if they have additional questions. I think
just very quickly, because we're out of time, has his reputation been damaged? Yes or no?
Well, I think, look, clearly this was a painful period for him. And as he said yesterday, it cannot be easy for a prime minister to go through this. This is
That's a yes.
Difficult. No, well, it's a difficult time for him. And I think we should respect that a little bit as well.